Right. Richa, you've been meeting a lot of survivors, victims, and also doing your bit to raise awareness.
Yes.
What are the sort of messages that you hear from them? What would they like to see done differently?
I had the fortune to meet some women who I would not call them survivors. They were victors of cancer. And they spoke about things that you and I can never even fathom, about the stigma that possibly they feel when they lose their hair due to chemotherapy. For Indian women, hair is such an important aspect of their beauty and vanity and things like that. So for these women to not just lose their hair, but eyebrows, eyelashes, it was a really big thing. And some of them chose to go without a wig, some of them chose to wear scarves. And I think the one defining thing that, that was present in all of them was that they were really strong, they were carefree. In fact, just now, Ajay and Ekta, the two cancer survivors you had on the segment before ours, they were also constantly smiling. It's as if they feel like they have nothing more to lose, and that's something that I find very inspiring.
We also did hear those stories earlier as to sometimes the battle with cancer really changes your outlook to life and sometimes makes it very positive.
Right.
And is that something you encountered too?
Yes, definitely. And there was this girl, she was afraid of losing her job because she was diagnosed with cancer, and she was like, go ahead, fire me, I have cancer, how much worse can it get? And then she fought it, she fought the disease, she was fine, and she went back, and the agency wherever she was working hired her again, and she's now living a normal life. So I feel like everybody should know not to treat somebody who's been diagnosed with cancer as someone who has like a suspended death sentence. That's now how it should be looked at. It's definitely curable. It's spreading like an epidemic, so there are things we should do to control that. I'm sure you have experts on the panel who speak about it. But be kind and be positive. I think that's the first thing to do.